I think UB is one of the first schools around the country to be incorporating formal patient safety curriculum into their overall medical school curriculum. The personal aspect of the situation with Mary's mom is a piece that was really missing from the curriculum. I hate to say it, but doctors make errors a lot. You know, in those few cases where there are very significant consequences, it's important for students and doctors to realize what those consequences are and what a huge impact it has on the life of the patient or the family members. And so this just really helped it to hit home on a personal level with the students.
On July 4th of 2009, my mother, an 88-year-old, very active, very vibrant, very spontaneous woman, went to a family party for 4th of July. She enjoyed herself, had a wonderful time, and within about a week, she was experiencing some leg pain, a little bit of perhaps gout, a little swelling in her right leg. Went to her primary physician. He said, you know what, I think maybe we need to have you go to the hospital, take a look, have an orthopedic fellow take a look at you. When she contracted not one, not two, but three hospital-acquired infections, that certainly was alarming to me, that she had C. diff, MRSA, and VRE. And I really kept track of, you know, almost in a calendar of the things that were going on, and I would come home every night and say, it cannot possibly get worse than this. And then the next day it would be something else. The thing that really was the eye-opener for me was her death certificate. On her death certificate, it indicated the cause of death was sepsis. And you should not die of sepsis 48 days after you go into a facility. You shouldn't die of sepsis when you go in for gout. You know, it just shouldn't happen. It is preventable. I reached out to the University at Buffalo Department of Family Medicine, and they have a remarkable resource with the Patient Safety Research Center. The medical students' evaluations came back, and they were very touching. As a matter of fact, they made me cry. They were very touching. They said, you know, we'll never look at maybe patients in the same way again. I mean, the fact that 1 in 3 hospitalized patients will have some form of medical error is frightening to me. That's dramatic, and something has to be done. This I consider true healthcare reform. This, if we look at patient safety seriously, if we, from the CEO's office and the boardroom to the cleaning staff, make this a priority, put the money where it needs to be, put the attention to detail where it needs to be, and be committed to having zero tolerance for hospital-acquired infections. That's what needs to happen. I think that the work with University at Buffalo Nursing School and the medical school has already been more than I could have expected. The fact that this remarkable institution has welcomed me in and has given me an opportunity to talk with people who are going to be emerging as the medical professionals of tomorrow, and giving me an opportunity to share the story and encouraging them to think of patients differently, to think of safety differently. That's a huge step forward. They're all integral to that patient safety, and they all have to communicate and deeply communicate. And nurses have to be able to ask questions of physicians, and physicians have to ask questions of pharmacists and nurses, and they just need to work together as a team, remembering that the captain of the team is the patient.